Hello, my name is Michael Cordonier, and I'll be telling you a story today. At the end of last year, I started taking baptism classes. Uh, I was mostly doing it for my wife so that my family could go to church again on Sunday, as we were not married by church at this time. So, as I was taking these baptism classes, uh, in the middle of January, I was assaulted at the reception and treatment center where I work. I'm a unit manager, and an inmate assaulted me. I continued the classes at this time. I wanted to see it through. I wanted to do something for my family, and I wanted to continue to make myself a better person. Um, when I got baptized on Easter Advent, I remember 2 days later, I was in the doctor's office, and Dr. Henning was telling me, Michael, you have cancer. Now, that's a scary diagnosis for most people. It's one of those words you don't ever want to hear. Um, I remember that at this time, I would normally never even go to the doctor. It's not something that I would do personally. The only reason I had even gone in was because I'd been assaulted and it was required. Um, I was lucky to have cancer found while I was in my 30s and not later when obvious symptoms would have appeared like blood in my urine. That is why everyone should see a physician for yearly wellness and health checkups. It took multiple blood tests over time to find out that my enzymes from my liver were not lowering. And my doctor was just curious as to why they were so high. I can remember being called and asked about, hey, do you drink alcohol every single day? And I would say, no, it's not something I do regularly. They called my wife afterwards, rang her up, and said, hey, does your husband drink every single day? Because his liver enzymes shouldn't be this high. Um, I, at the time, took it a little as a joke because I was like, who knows? There's any number of reasons why liver enzymes can be high. Why is this so concerning? You know, what do I need to do? And why is this such a big problem? I didn't know. A doctor had to tell me why high liver enzymes is important, why you would need to see a doctor for enzymes being high because it signals that something else is wrong inside of you. Um, I want you to take my story seriously and consider what would have happened if I had never gone to the doctor. I want you to take health checkups seriously and get one scheduled for yourself today. In this speech, I'm going to talk to you about um, reasons that you should take yearly checkups seriously, how my cancer diagnosis affected my outlook on health checkups, and why you should take your own health seriously and get your checkups now. Yearly checkups are an important part of making sure your body's okay. You can't see what's going on inside of you. You don't know your enzyme count or your blood sugar levels, but you can go to a doctor and have blood drawn to show you your cholesterol levels, your blood sugar levels, and to just evaluate if you're living a healthy lifestyle, taking care of your body. Getting comfortable and sharing information with your doctor as important to establishing a healthy relationship and openness for the future. so you guys can communicate when you don't feel right or you think there might be something wrong with you. You should just go to the doctor, put your phone down, don't look on WebMD, don't search up what diagnosis you could possibly have, because you don't want to get yourself worked up before you've even gone to the doctor. Take it to somebody who knows what they're doing. If you have looked on WebMD, maybe you just go in and you talk to them about what you think might be going on. And they'll have a way to ease your mind, talk you through it, or to let you know what the next steps are. You could also just go to the doctor and just have questions about, I don't feel okay, or maybe my eating and lifestyle are not okay. Maybe I just want to explore what going to a gym would look like. There's many resources that doctors have that you and I don't have access to on the everyday. A doctor can get you to a dietitian. They can get you seen by a specialist. They can also recommend healthy lifestyle advocates that can help assist you on your journey. I never took checkups seriously, and through chance, I was given the opportunity to share with you to just go to the doctor now. Put all those questions in the back of your head when you're lying in your bed at night before you go to sleep. Put them at ease. Go to the doctor now. Next, I want to talk to you about my cancer diagnosis and how I feel that it affected my outlook on health checkups. I remember driving to Urology PC for a meeting with Dr. Henning, somebody I didn't know at the time. I remember looking up his name just to see what he looked like and thinking, this guy, he looks kind of like Tom Arnold from Total Recall. Arnold Schwarzenegger movie, if you didn't get that. I remember that my first thoughts were, I want to meet this guy, just see if he really does look like Tom Arnold, because his picture looks like Tom Arnold. So I went into the office, nonchalantly. I was just kind of going because at the time I was off due to my injury, and I figured, why not? Why not just go in, put your doctor at ease, so they'll stop hounding you, calling your wife, you know, things like that. So I remember the first thing he came in is he goes, can I show you a picture on the computer here? And there just happened to be a giant computer in the middle of the room that he could pull x-rays up on. I remember he pointed to what would have been the right side of my body on the x-ray scan. And he said, you see that? That's what a normal kidney looks like. You can see the shape, you can see the light, you can see how the contrast is being picked up by the x-ray machine. And then he looked at the other side, what would have been the left side of my body, and he said, you see that? That's cancer. And right after this, I remember he went on a 20-minute extemporaneous speech of himself about, you know, the diagnosis, statistical facts about it, what the options of treatment were, what other types of support I might need. He wanted me to know that I had time to think about it as well, and that he would just kind of let me stew in it for a minute. If I wanted to go home and talk to somebody, or if I needed somebody to sit in the room with me, he could have somebody sit with me or talk to me about it. And I remember I was just like, well, it sounds like if you're saying surgery is the best way to get rid of the cancer, we should probably do surgery. And he went on to speak about the surgery, about how there's so many other complications that can happen because they have to clamp off blood supplies from the arteries to the kidney, and the blood flow, and it needs to be done within a certain amount of time or there can be other damages, higher chances of clots, things of that nature. I remember we spoke about how the surgery would cut into me 5 or 6 times, and he would remove it from one hole specifically, and that's where I'd be in the most pain, normally speaking, is because of the inside out of the removal, and how I might just lose the whole kidney, because his main concern as a doctor was to get rid of the cancer. And sometimes we don't know what a doctor's goals are without speaking to them. And it's important to talk through all those things with your doctor to find out, like, what is your doctor's main concern with whatever health issue it is that he might have seen you have right now. And I know that with my story, for example, he was mostly concerned with removing the cancer. He wanted me to get chest scans to make sure it didn't metastasize and spread, and he wanted to make sure that it was controlled into one area of my body, so that when he removed it, if he did have to remove the whole kidney due to blood loss or anything like that, that he could safely remove the whole kidney and say, I did my best and I removed this cancer from you the best that I could. Now, this is why the doctor gave me the best fighting chance. Because imagine 10 years from now, if I had just gone undiagnosed because it's an asymptomatic type of cancer, where it's only in the later stages when you start having blood in your urine or other urinary problems that you would even notice. But somebody like me, would I have even gone to the doctor at that time? Or would I have just continued to ignore it like I normally do? I was taught, rub some dirt on it and keep moving. That's what I was always told. Going to the doctor was just another amount of money you were wasting on something instead of, food on the table or something when I was growing up. But again, take my story seriously and consider giving yourself that same chance to save yourself from a terrible diagnosis later on. Finally, I will tell you about why you should take your health seriously and get a checkup. Checkups can help us detect and find problems we can't see. Right now, you may be wondering about a lump or feeling sick after you eat pizza. Is it cancer? Is it your insulin levels? Are you not happy with your weight? Or maybe you feel defeated by all the stressors you have in your life, and you just need somebody to vocalize those to, who can be a sounding board for advice and help, because that's really all doctors want to do at the end of the day. They just want to help you take care of yourself. They want to assist you in that journey of taking care of our bodies and giving us the best treatment that they can. Preventing things like cholesterol can stop your arteries from becoming clogged and stop heart attacks in their tracks before they occur. Medication, diet, and water can help with high blood pressure, which puts a lot of strain on your heart and your other organs. Insulin can help your blood sugar levels, or just inform you of what diet restrictions you should be following. Your mind could be at ease right now if you found out the lump was just a free-floating cyst and nothing to be concerned about. You could also find out you have cancer now, and that there's a fighting chance to be cancer-free. I remember the doctor, he scheduled surgery for me 2 weeks after I saw him. I had to go get scans and IV contrast with more scans to make sure it hadn't spread and metastasized, so that it wouldn't be interfering with anything else going on if I had other concerns with my cancer. So again, yearly checkups are an important part of your health and wellness. I know from experience. I am lucky to have found my cancer early before it spread throughout my body, um, especially once it's moved throughout your body. The chances or the likelihood that you can live a happy and healthy life after that drop way down. So again, that's why you should put luck in your favor and get a checkup scheduled now. Schedule your yearly checkup with your doctor right now. You're important, and you need to take my story seriously and take care of your body by seeing your doctor. I myself already have my appointments booked out for the year in advance to screen for cancer and to make sure it stays away and it doesn't come back. My doctor told me, he said, "You and me, we're going to get to know each other very well over the next 5 years." And I thought to myself, does that mean I'm going to be seeing you a lot? And I was right. So again, I was lucky. I found my cancer in my 30s and not in my 40s or 50s when it comes with a death sentence. I feel like I was blessed with finding out I had cancer early, making treatment have the best possible odds for success. And I can now live freely knowing that I can take care of my wife and my 2 daughters for the rest of my life, and it won't be cut short by something as scary as cancer. So do yourself a favor, pick up your phone, call your doctor, tell him you just want to come see him and talk to him about whatever's been on your mind. Thank you.